My name is Chris Glattes. I'm an orthopedic surgeon with Elite Sports Medicine and Orthopedic Center, and I specialize in spine surgery. The thing that probably drove me into medicine and orthopedics was my mom. So she was actually a surgical scrub nurse. So she worked for the University of Kansas Department of Orthopedics in the 70s. So she worked at another community hospital called St. Joseph's all throughout the 80s. And so she was a pretty big influence, and she loved doing orthopedics. She could do just about everything as far as OR work. So she was an important person as far as kind of directing me into medicine. One of the things with spine surgery that I think is pretty cool is that there's a lot of crossover, and there's a lot of crossover from the sports medicine folks to sending patients to us, but vice versa. There's a lot of folks that come in thinking that they've got a spine problem, when in actuality it's a hand problem or a shoulder joint problem or a hip joint problem. And all you have to do is just listen to the patient. The very basic things that they teach us in medical school that sometimes people try to forget. You just have to listen to the patient. You have to do a very straightforward examination, watch them walk, do some basic things, and you can usually figure things out pretty quickly where it's coming from. So, and then the nice thing is we don't have to, with having all the subspecialties covered within our practice, we really don't have to work very hard to find a great physician to send them to. So in orthopedics, it's complicated enough, and there's enough subspecialties that you really can't do a great job of it at everything. And so I think it's always best, in my opinion, to find something that really you get connected with, and then kind of really focus your work on that. Until you are a patient yourself, you don't realize how scary it is to not really know what's going on. So, and luckily I've been healthy throughout my years. There have been a few random things that have come up. So, but every once in a while, you find yourself sitting in a doctor's office, and you have to put yourself in your patient's footsteps. And so, you have to be empathetic. You have to understand that, how things affect certain patients. It may affect others in different ways. And it's a difficult thing to do. So, but I think that as long as you always remain empathetic and you understand that patients have different issues that they have to work through, I think that that's the most important part about improving the patient's experience. My name is Chris Glattes. Thank you all very much for watching, and you can learn more about us at www.eliteorthopedic.com.